So to take someone's blood pressure, you have to have a blood pressure cuff and a stethoscope, and obviously a patient. Before you begin, you want to make sure that your cuff is completely deflated, so there's no air. And to do that, you make sure that this gauge is turned to the right, and then you release all air. After that, you turn it all the way to the left, so that the air will stay into the blood pressure cuff. Now to begin, you want to have your patient sit in a chair completely relaxed with feet flat on the floor. And then on the blood pressure cuff, it will have arrows that will tell you which brachial artery to put the blood pressure over. So for his left arm, we're going to follow the left arrow. And we'll put it over their arm, not to where it's crazy tight, but tight enough that it's not going to fall off. And then have them relax their arm in a rested position. You want to attach the gauge some way so that you can see it. And then for your stethoscope, you want to make sure that the earpieces are faced outward. And then you will put this part of the stethoscope over the inside of their elbow on the soft spot. And then you make sure the gauge is turned all the way to the right. And then you will inflate it to about 160 to 180. And then you'll slowly turn the gauge to the right to release some air, slowly. And then you will watch the gauge and look for when you see the first sound, you will look at the number for it. For the first one will be the systolic pressure, and then the second one will be your diastolic pressure. So for his, the first sound that I heard was right over 150, and then the second sound I heard was right over 78. So then you'll release the air completely, and then you'll take the blood pressure off of the person, and you will, to put everything away, you want to wrap both your blood pressure cuff and your pump around the blood pressure cuff, and then roll it so that they are protected so they don't get broke. And then most blood pressure cuffs come with a bag, so you want to place it in the bag. Once that's done, then you put everything back, and you will go and report and chart what you've seen, and you will take other vital signs along with this. For a systolic pressure, it's going to be the first pressure sound that you would hear, and that's normally generally around 120. It's okay if it's a little bit higher. And then diastolic is normally around 80. So that is how to take your blood pressure.